Hello, everyone, and welcome to this launch event of this preliminary market consultation organized by Jesús Usón Center for Minimally Invasive Surgery in Extremadura, Spain. The objective of this market consultation presented today is to test the market, to ask the market about their capacities on robotic systems for minimally invasive surgery. So the result of this consultation may fit the procedure of Public Procurement of Innovation, which has been started by Jesús Usón Center in the framework of Project TREMIRS, financed by Junta de Extremadura and by the Minister of Science and Innovation and the ERDF funds. This is today's agenda. Where we will have in this English version Dr. Francisco Miguel Sánchez, which is the scientific director of Jesús Usón Center and principal investigator of TREMIRS project. Then we will have Dr. Juan Alberto Sánchez Margallo, who is researcher in the unit of bioengineering and sanitary technologies of Jesús Usón Center and TREMIRS project manager. And then we will have a presentation of the preliminary market consultation by myself, Santiago Donat from Ayming, the consultancy helping Jesús Usón Center to carry out this consultation. And then we will have a Q&A session moderated by Ayming. Before getting started, I would like to explain just few recommendations specifically to this English version. This English version is a video already recorded, and if you are participating or following this video at the same time than the live session, you have the option to leave your questions and any other inquiry in the chat that is available in the live session, which is in Spain. Later on in the Q&A session, in the live session in Spanish, you will be able to interact with the experts either in Spanish or in English. So I also ask the speakers to stick to the time, and yes, please, Mr. Sánchez, Francisco, the floor is yours.
Okay, thank you very much. Hello, everybody. Thank you for your interest in this session. And I'm going to talk about the background of the project and introduce you the Minimally Invasive Surgery Center. Thank you for being connected. The main goal of this project is to offer new solutions for the healthcare systems in the field of minimally invasive surgery by developing innovative solutions in surgical robotics in order to improve the systems currently available on the market. We propose that these solutions will be focused on laparoscopic surgery and microsurgery. Our ultimate goals are to offer a better service to the patient, better capabilities to the surgical team, to improve the surgeon's ergonomics, and to offer innovative training solutions in robotic surgery, among others. The Minimally Invasive Surgery Center is a multidisciplinary public institution devoted to research and innovation in health sciences. We have a large experience in translational research, and we cover several fields of expertise, such as laparoscopy, endoscopy, microsurgery, endoluminal therapy, anesthesiology, pharmacology, bioengineering and medical devices, stem cell therapy, and assisted reproduction. In addition, we act as a contract research organization focused on in vivo preclinical services for the pharmaceutical labs, medical devices companies, and biotech industries. On the other hand, the center is part of a singular scientific and technical infrastructure of the Spanish Ministry of Science, is a member of the National Cardiovascular Research Network, and the minimally invasive surgery organizes hands-on training focused on minimally invasive surgery, including an official university training program for more than 2,300 students every year. We also have huge experience in participation in European, national, and regional research projects in collaboration with public and private partners around the world. As we all know, it has been widely described that advances in surgical robotics or robot-assisted surgery have made it possible to perform complex surgical procedures with more precision, flexibility, and control compared to conventional laparoscopic or open techniques. If we focus our attention on the field of laparoscopic surgery, this surgical approach is performed through small incisions in the abdominal wall using specialized surgical instruments and an intracorporeal camera. The main benefits of minimally invasive surgery are the possibility of performing less traumatic surgeries with better aesthetic results and a shorter recovery time for the patients, and the possibility of saving on healthcare costs. In order, sorry. Okay. In order to address the limitations of minimally invasive surgery, robotic-assisted laparoscopic surgery can offer important improvements such as 3D vision of the surgical field, more precision in surgical movements, tremor control, and improved ergonomics for the surgeons. However, today this technology also entails a significant increase in equipment acquisition and maintenance cost. There are still many surgical approaches to which they have not yet been applied. They offer an almost exclusive benefit to the main surgeon, and there is still a lack of scientific evidence on improvements in surgical outcomes over conventional laparoscopic surgery. As for microsurgery, this type of surgical technique requires a visual magnification by means of a microscope and the use of specific surgical micro-instruments. This makes it possible to operate on small anatomical structures such as vessels and nerves. However, this surgical discipline has some limitations, such as the possible restrictions of precision inherent to human beings and potential tremors in the use of surgical microinstruments, as well as the ergonomic constraints for the surgeon during the surgical performance. In this regard, robotic technology offers wide-ranging benefits to microsurgery, such as the filtering of tremors and the scaling of movements during the use of surgical instruments, and best ergonomic posture for the surgeon during microsurgical procedures. However, there are currently few robotic platforms for microsurgery available on the market, and their application to lymphatic microsurgical procedure is still uncommon. In this slide, you can see the main members of our work team at a minimally invasive surgery center who will work on the project from different areas: clinical and surgical, economic, management, engineering, legal, etc. Thank you very much.
Thank you very much, Dr. Sánchez. I think it has been very useful, this introduction, this presentation of the Center Jesús Usón, and give an initial introduction to this project, TREMIRS project, with the background. Let's now dig in a little bit more and listen about the challenges and needs of this project with the description of project challenges by Dr. Sánchez Margallo, as I said, is researcher and bioengineering and health in the bioengineering and health technologies unit and project manager of the project. Please, Juan Alberto, the floor is yours.
Thank you very much. So let's going to talk about the project challenges. So at this moment, we have identified certain limitation of the current robotic platforms for minimal invasive surgery that should be addressed, such as their application for new surgical techniques and approaches, and therefore going beyond the conventional surgical procedures. There are still some ergonomic limitations for the surgeons. The functionalities for the entire surgical team are limited, since the robotic platforms are made for the main surgeon, and portable online training solutions are scarce. Therefore, with this project, we seek to address the limitation of commercially available robotic surgical systems for both laparoscopic surgery and microsurgery, in order to offer a better service to the patient, better ergonomics to the surgeon, and greater features for the surgical team, with a consequent improvement in the quality of care provided. To this end, we propose two challenges: the development of a robotic platform for laparoscopic surgery and the development of another platform for microsurgery. So the main, for the first challenge, for the robotic platform for laparoscopic surgery, the main objective is to develop a robotic platform for laparoscopic surgery that improves commercially available systems and that optimizes the conditions during the development of the surgery for the patient, the surgeon, the surgical team, and the medical professionals undergoing training in surgical robotics. The platform should present innovative solutions to address the main limitations of current robotic systems. To achieve this general objective, the solution should accomplish the following specific goals: to offer greater precision, dexterity, and quality in minimally invasive surgical procedures, to apply robotic technology to new procedures and surgical approaches, to improve and customize the ergonomic conditions of surgeons, with the consequent reduction of in the onset of possible musculoskeletal disorders under effects on surgical performance and on surgeons' health, to provide new surgical assistance tools to the entire surgical team, such as the use of 3D vision, virtual, augmented, and mixed reality, and finally offer new portable tools for remote training in robotic laparoscopic surgery, as well as improve training materials, such as the use of 3D videos of real robotic procedures. Therefore, the main areas of application of this challenge will be the development of new surgical instruments, the application to new surgical approaches and procedures, the improvement of surgeons' ergonomic conditions, the development of surgical assistant tools for the entire surgical team, and also the implementation of portable training tools. Regarding the robotic platform for microsurgery, its main goals are the development a teleoperated robotic platform to perform open microsurgical procedures with articulated and interchangeable micro-instruments. To provide a set of robotic micro-instruments with high dexterity and precision, and operated in an intuitive fashion similar to conventional microsurgery. These micro-instruments will allow the manipulation of small soft tissues to perform microsurgical procedures such as anastomosis, suturing, and ligation on small anatomical structures, including blood vessels, nerves, and lymphatic ducts. And finally, the system will should be compatible with most of the microsurgical optical microscopes. To achieve the general objective, we should accomplish also the following specific goals: the development of the initial studies for the definition of the clinical and technical specification of the microsurgical instruments, the design and implementation of a set of multi-articulated robotic micro-instruments to perform basic microsurgical procedures, maybe for vascular and lymphatic surgery, the design and implementation of an intuitive control system for the robotic micro-instruments. These controls will allow surgeons to work in an ergonomic position similar to the one that we have during conventional microsurgery. To reduce the surgeon's physiological tremors and the scaling of movement during the use of surgical instruments. And finally, the validation of the robotic platform for the performance of basic microsurgical procedures. Therefore, the main areas of application of this challenge will be the design and development of articulated micro-instruments, the implementation of an intuitive and ergonomic console for the surgeon, the development of methods for tremor filtering and movement scaling during the use of surgical instruments, and finally, the validation of the robotic platform in vascular and lymphatic microsurgical procedures. Thank you very much for attention.
Thank you very much, Mr. Sanchez. I think it was a very well structured and detailed presentation of the two challenges presented today in this market consultation, and also the areas of application. I think will be very useful for the market agents to focus their proposals. And now we are going to explain a little bit the main steps of this preliminary market consultation, that it will be done by us. First, I think this is the blocks we are trying to structure our presentation. First of all, we would like to give a brief introduction of the concept of Public Procurement of Innovation, PPI, as it is a very powerful mechanism to boost innovation that is being slowly gaining importance in Spain and in Europe, where the public sector can improve their products and services, while at the same time companies can invest more in research and innovation projects. But first, we have to say a little bit about the basic. It's not a new type of contract. There is a legislation of public procurement at European and Spanish levels that foresees this type of contract. It's not a new kind of procurement. There are the same time of procedures that the normal procurement. But yes, it is a very powerful mechanism. It's a policy itself of innovation, where the public administration becomes a key player, boosting innovation to transform the productivity model and creating new innovative markets. It's not subsidizing the innovation, it's buying the innovation from the companies. And We have two big winners who are the public sector, who is being a main actor in this creation of innovative markets, demanding innovative solutions for their challenges and needs that the public sector has today. And at the end, this improves public services, gives more efficiency and effectiveness on public services, and at the end, this improves the quality of life of our citizens. But while at the same time, companies can offer their products and services to a big buyer like the public sector, can develop their research and innovation in real environments like the public sector, and at the end you increase your selling, increase your turnover, and has a positive impact in your turnover and your profit and loss account. This is the PPI cycle that most of the guides are presenting today. Three main phases. One is the phase of planification, where needs, objectives, and strategies are set up, and then is a second phase of content and publication, when there is an interaction of the market and the public sector, and third is the management and acquisition, if possible, of the solution by the public sector. We are today here in phase 2 with this preliminary market consultation. Also, some consideration about preliminary market consultation. Preliminary market consultation are foreseen in the in Spanish law, in the Article 115 of Ley de Contratos del Sector Público. Is a transposition of the EU directives from 2014. It is a good practice, however, for any type of procurement, not only for PPI, and consultations of the market allows for a technical dialogue with the market. First of all, to understand the capacities of the market for the challenges presented by the public sector, the Jesús Usón Center in this case, and also it's very important, on the other hand, to inform the market agents about the plans of the administration and the requirements that these solutions should have. This preliminary market consultation is not a contract, but it forms part of the contracted record, is part of the pre-contractual stage, and also as it is part of the contracted period, the contracting record, sorry, it has to fulfill with basic principle of procurement, like non-discriminatory, transparency, and full access to all operators. That's why it's open for any person, legal or natural person, that would like to engage and participate and offer some knowledge about this topic. And last but not least is this consultation, this preliminary market consultation is not binding with the future procurement, not for the public administration. Let's say the public administration is not obliged to launch a tender at the end of this procedure if does not have enough information, or the need is not well developed by the private sector yet, is not binded to launch a tender. But also the market operators that participate in this consultation, there is any binding with the information they provide in this consultation. That does not give them any advantage, and also they can then refuse to participate in the tender, so not binding for any of the parts. If we go ahead with the calendar of this preliminary market consultation and next stages, we have, first of all, the launch of this consultation, which was the 8th of March, is already out there and is running until 12th of May. Yes, it's running until 12th of May. Is the closing date for the proposals of ideas, but it's going to be extended and later on will be confirmed by the responsibles of the project. Is extended to the 27th of May. This is a very important date because it will be the end to receive proposals by the companies or market agents interested. Then we'll start a period of analysis where interviews with companies or additional requirements may take place. And by the mid of July, is expected to have the conclusions report of this preliminary market consultation. Then next steps that will follow in September, around last week, it will be the publication of the Public Procurement of Innovation notice that will advance the publication of the tender of Public Procurement of Innovation, which is foreseen the first week or around the first part of October. A seminar for the presentation of this tender with all the details about this tender will take place afterwards, around first quarter, mid part of October, and the closing date to present the offers of the Public Procurement of Innovation is foreseen to the last week of November. We have to take into account that this project is being financed by the ERTF and the period will end at the end of 2023. So the deadlines are expected to be speed up as much as possible. How to participate? So before 27th of May, every interested person of company should take these 3 steps: access the consultation, complete the template, and send the proposal. To access the consultation, you can find all related information of this market consultation in the following websites, either in the public procurement platform or in the Jesús Usón Center website, or even in the Project TREMIRS specific website. You will find all the documentation needed to prepare your proposals. First of all, you will find the document of the call with basic information about the objectives of this project, as we have seen today, challenges, but also important information about deadlines, submission details, and also aspects regarding confidentiality of the information sent, etc. In this document, you will have also the templates to fill in. Is one template for each challenge presented today. We have 2 challenges, so there will be 2 templates. We will explain after the details. There will be also a frequent asked questions available on the website that is being developed. Also presentations we are presenting today, and the videos. This video will be presented also in this website. To complete the template, what are the key aspects of to participate in this preliminary market consultation? Annex 1 is for challenge 1, the robotic platform for laparoscopic surgery, and Annex 2 is for challenge 2, robotic platform for microsurgery. The idea of these annexes is to collect information. Well, first of all, general information about the company, also the name of the project you are proposing, but the main objective is to collect information about technical and functional specifications, and also about the budget. You will have there will be a list of technical and functional requirements by block, and you will have to score each requirement, how much is important you think is. So at the end, the organization will have the opportunity to see which ones are more important or not for the companies. At the end, you will have to give an estimation of the budget of the cost to develop each block. And also you have a box for free text at the end of each box to add any further need or aspect the company thinks that the solution should have. So this will be the way to participate in this consultation. Third step, send your proposal. You have to send your proposal to the following email address of Jesús Usón Center. You have here the instructions to identify the email, and also in this email you will have to specifically express your interest to participate in this preliminary market consultation. Then once you have participated, we'll arrive the analysis stage, where the Jesús Usón Center will analyze all the information of every form received properly and fully fulfilled. If there is some doubt about any information, the law is forcing the law. The center is allowed to contact the company to further clarifications, or even for interviews if needed. Then also the all additional information provided by the company will be analyzed with some criteria, which are the following. It will be analyzed by the level of innovation of the proposal, the adequation of the idea to the challenge, and also the opportunity for the development of replicability, taking into account the challenges and area of applications presented today. At the end of this procedure, and with the last, the final report, the Jesús Usón Center will determine if the information received has enough quality and is meaningful to be included in the contract specification of the future tender, and this will be published in the final report, when with a list of all the consultations made, interviews, or so on. And just to conclude, is the importance of participating in this market consultation is key, because it's a good opportunity because sets the basis for the elaboration of the contract specifications regarding scope, contract requirements, and budget. So what is asking in this case Jesús Usón Center, it will be answered by the markets. So there will be a certain level of critical mass to this call from the public sector, and also is the value of the preliminary market consultation to develop the project. Is this dialogue is very positive, because it can generate new ideas and solutions, and also it's a very good exercise of publicity, transparency, and also can encourage participation of SMEs, and also for consortium generation, because here companies see each other and can maybe present better proposals. So this is everything from our part. We remind you that this is the video version, and the Q&A session will take place in the live session, which is taking part in Spanish, but the Q&A will be developed in English and Spanish. I want to thank personally Dr. Sánchez Francisco and Dr. Sánchez Juan for their comprehensive and clear presentation, and thank you everyone to participate and being connected today. Thank you. Bye bye.
Thank you so much.